Hi there. Welcome to the November Food for Thought. It's 5 things to know about Medicare today, things that you absolutely need to know. Lake Point Advisory Group is a wealth planning and financial services firm, but we also bring a lot of these other areas of value to clients, and we do little events like this. So we have a really large audience today, and I'll welcome our 2 guest host here in just a second, but we have a large audience, and guys, I want you to remember that there's a spot over there where it says chat, and you can type in your questions and it'll show up on the side of the screen for me. No one else gets to see what kinds of questions you want to put out there, but we'll have a list of them starting to show up so that we can go through and have some Q&A as we have this very informational event here today on Medicare and things like that. So first thing I want to do is I want to welcome Tanya and Chris to the meeting. We got Tanya Boyd and Chris Renfro. And, Tanya, I've known for a long time now. We met in a very unique way. Tanya was buying a desk that I didn't want to carry back upstairs. And she was looking for a great desk to put in her home office. You're probably, we won't say how long ago, Tanya, but it's been a while. We've known each other a long time. And Tanya is the president and CEO of Tanya Boyd Associates, where as I've said to people many times, when it comes to health questions for individuals and small businesses, from birth to over Medicare age, Tanya is where we want to get some of those answers. So I'm proud to have Tanya here to talk about this with us today. And Tanya also has a great team behind her as well. And part of that team is Chris. He rarely smiles, guys. Let's see if we can get Chris to give one of those smiles for us. There it is. Yeah, see? Because we have Chris Renfro with us as well, and Chris is very much so a specialist in the Medicare area. Some of you may have already met him in the past, because you probably heard me say, let's talk to Chris and get some of these answers. He keeps up with this better than anybody that I know. And I want to start there, Chris, actually, because we're talking about Medicare, specifically, and there's this time of year, right, where it's open enrollment. And there's a lot of questions about, well, what does that mean, open enrollment? And how does that work for everybody? So, just take a second there and tell us a little bit about that and just some general about Medicare for a minute.
Well, thank you so much for the wonderful introduction. I do try to smile more, but I think maybe it's dark in here. So it's, maybe a dissolution of some sort. But anyway, the open enrollment period is an annual event. It's the open enrollment period, annual election period. You'll hear it's called sometimes as well. It's an opportunity between October 15th and December 7th every year that allows seniors to make changes to really 2 different portions. The Part D, which are the drug plans, and then Medicare Advantage plans, which are health plans, which include drug plans. The reason why this is important is that if you don't make a decision between now and December 7th, you're locked in for the next year for all of those benefits. And every year, the government allows these drug plans and Medicare Advantage plans to refile their plans, which means they get to change deductibles. They get to change costs. They get to change the way they tier the medications in their drug plans. So this change and this time of change is extremely important for the next 12 years or 12 months of somebody's coverage going forward. So the one thing that it doesn't apply to, though, are Medicare supplement plans. You can actually change those plans every month. So anybody that has a Medicare supplement plan, those don't change until your birth month. They're not subject to the open enrollment period. And that's why a lot of people this time of year think, well, is my supplement going to be renewed? It automatically renews on your birth month, not the open enrollment period.
I see how that can be confusing.
Extremely confusing. Because
what's happening? A lot of things in this, Chris, and that's, I think I get a lot of confusion from clients when it comes to Medicare Advantage. Is it traditional Medicare? All of that stuff. Is there any, we're going to talk about some pretty sensitive stuff today, and we're going to try to stay out of, let's say, one company or one plan or anything like that. Is there anything that, you want to say about that will help everybody who's listening to maybe formulate some of their questions?
Yeah, absolutely. And I do need to thank you for reminding me to put the disclaimers in here that this is an educational speech, educational discussion. I will not talk about any plan specifics. I will not talk about any rates. I will not talk about any PHI, which is the personal health information, just so everybody knows that that's the way this needs to work. So I would love to answer your questions. You can get with me individually or Tanya individually, but I can't do it in a group format like this. Just for
I'm glad
everybody.
you said it, because that could help some of these questions going around as to, I'm already seeing some of them starting to show up on the screen. But I want to start with one just a little bit different. Let's back the age wheel up, right? We all want to dial back our age just a little bit. And just before Medicare. So Tanya, I want to come to you with this question because, over the years, a lot of clients I've sat down with felt like they were tied to the work post, if you know what I mean, just to get the health care. Because I feel like they can't retire without healthcare. So they're 58 or they're 62 or 63 and they're going, I can't quit working because of health insurance. And it breaks my heart. I mean, what kinds of options are there in that world?
Well, so you've got to understand everybody's situation is different. And I do get a lot of phone calls. And so it's consultation. So number one, don't be afraid. They're afraid because they don't know. It's just the fear of the unknown because their employer's taking care of health insurance. They don't have to think about it. So they've got no idea. Take action, get in touch with someone, a professional where that's all they do is health insurance, and they're going to go through different options. Again, everybody's situation is unique. And here's someone recently that I spoke with, just as an example, went through the different questions with this individual, and this individual is very well off, has plenty of money in retirement and in their bank account, is not ready for Medicare. But this person's income that they report is in the price range, or it's in the income range that would get them what's called a tax credit or a subsidy, which lowers their monthly premium in the individual health insurance market. So I was actually able to show this individual a plan that was zero deductible. If he wanted to pay $200, he could get a zero premium, or maybe $200 premium, and then with zero deductibles.
Wow.
So it's very eye-opening. People think, oh, well, I've got $1 million in the bank, or I have investments and I'm not poor. There's no way I could qualify for a tax credit. That isn't necessarily the case. And especially with you being a financial advisor, this is very helpful for you to know as well. So that is one option. We've also set up, we can talk sometimes about group health options. If we have a husband and wife, we've set up plenty of group health plans with just a husband and wife. And we do that if they really want to have a PPO plan. And that PPO plan with their employer is insanely expensive. Cobra's out, crazy.
Right.
So that's one of the things. If they're healthy, we're always going to mention, look at a sharing program. So it's definitely, sometimes I tell them you need to stick with Cobra. It's amazing. You just ride that out until as long as you can, and then let's plan like 3 months before that, or here's what I've got for you. This is what I would recommend.
There's a lot out there, Tanya, a lot of options for
Definitely.
people. And instead of that whole feeling of like, I'm stuck with, I'm going to go pay for some horrible HMO that, I'm going to have this massive deductible and these terrible doctor network. It's not necessarily that world. There's a lot of options there. And it sounds like sometimes it's even cheaper. I know that people we've worked with in the past that I've sent to you, they came back and said, David, you're not going to even believe what we just found out. And I said, well, you might try me because I'll believe it, but I wanted to send you to the person who can tell you for sure that that was real instead of me taking a wild guess at it. So in other words, don't be afraid, right? If you're trying to plan beforehand, let's get you in touch with a team.
Yeah, don't be afraid. Start planning. Talk to someone like us so that we can go through all of the questions and give them the different options. And
okay,
it takes a while, and it's a lot for them to think about. And but we try to make it very, very simple for them and give them ideas, and so they know what to do, and they know how they're going to proceed with retirement.
I love it.
But I agree with you. Nobody should be stuck in a job because of health insurance. No one.
I know there's a lot of clients on the phone at Tanya. I'm sure you've heard me say this too, as long as we've known each other. There's nothing better in life than having options. So let's find out what our options look like as we go through things like that, which options also, Chris, when we do get to that Medicare age, the same kind of thing of being, we've got, like you said, Medicare Advantage, traditional Medicare. What are some of the differences between those?
Well, that's kind of a really broad question, Dave. Appreciate
You're
you
welcome.
first of all. There's really two main options when you get to Medicare age, right? There is traditional Medicare with a Medicare supplement. What that means is whatever Medicare doesn't pay for, the supplement sits right on top of it and it pays those gaps. It's also known as Medigap insurance, Medicare supplements.
Yeah.
Medicare gap insurance and Medicare supplements are not Medicare Advantage plans. Right now, seniors are getting inundated with mail and phone calls and commercials because that's the only way that they can market legally. They're not supposed to be making phone calls to you. They're not supposed to be doing any kind of direct marketing.
Right.
That is illegal, but I bet every person on this panel has received a phone call of some sort talking about Medicare and these kind of things. Medicare Advantage plans are Part C of Medicare. They are the outsourcing of Medicare to private insurance companies. So they're all provided by your major corporations, major insurance companies. You are no longer in original Medicare. You're taking yourself out of a Medicare, and all those benefits are now being provided by private insurance companies under managed care programs of HMOs, PPOs.
So it's not, you're not still enrolled in good old fashioned Medicare. They take you off the rolls and they put you under the private insurance covering of another firm that has a plan, right?
Yes and no. Technically, you still are in Medicare because you have to have Part A and Part B in order to get Part C.
Okay.
So, but the replacement portion of it is instead of Medicare paying your bills, all that Medicare would pay in original Medicare is now being funded to and from the private insurance companies. Let me put it in perspective. If you join a Medicare Advantage plan, the government will send about $1,000 a month to that insurance company to provide benefits on your behalf, whether you go to the doctor or not. So even though they're advertised as zero premium, there is a cost, and that cost is being provided now by the government on your behalf. Therefore, you're technically not enrolled in Medicare, but you did not lose your Medicare opportunity.
Okay. I think you just answered one of the questions that came across, which was, how do these insurance companies make any money if you're not paying hardly anything in premium costs? So, and every insurance company has to still make some money, or well, then they just go out of business, right? And then we don't have any coverages left anymore. And I think it's a bad idea, Tanya. You think that's a bad idea if insurance companies just disappear off the face of the earth?
Definitely.
Yeah.
And they've done it.
For business, isn't it? So okay, so let's go back to something you said earlier, Chris, which was the Medicare traditional supplemental plans. It changes on the anniversary of your birth every year. So the month of your birth is when that changes. Does that mean that that's when you have an opportunity to make a change if you're doing standard Medicare, or can you do it anytime?
Great question. One I get about once a day. Medicare supplements, you can change them every month.
Okay.
Here's the catch. Medicare supplement plans are underwritten after your original open enrollment period. So in order to move from one plan to another plan, you will have to answer medical underwriting questions.
You got to keep yourself in good shape, do you?
Got to keep yourself in good shape. Now we're not talking about blood and urine underwriting like you would for a life insurance policy. This is strictly a matter of health questions. In the past 5 years, have you been hospitalized 2 or more times for any kind of cardiac, respiratory, diabetes? These kind of questions, which are directly
life-changing questions, kinds of things, huh?
Yes.
Okay.
Yeah.
Well, we should all then aspire to want to change our Medicare plan pretty often, because that means we're taking care of ourselves, right?
No.
The golden ticket on the back end. Yeah, it's a lot of work. I know, Chris. I know. Some of you guys, and I know Tanya and Chris, you both know this, that I started 20 years ago. The first thing that somebody told me I needed to do was help people with Medicare plans. So I've been around that a long time too, but a while back I decided to take a step back a bit and let the professional experts who spend their time in that keep up with all the changes. So that's why I have you guys, and you're such a great resource to the clients, and we hear such great things about you. So Tanya, I want to throw this one at you here, okay? Medicare D is and a prescription drug plan. They're not the same, right? Do they go together, or how does that work?
Well, no, okay, they are. So Medicare Part, so let's go back. So what Chris was saying with the Medicare Advantage, now Chris, Medicare Advantage plans also include drug coverage, correct?
They do.
Yes, yes. So if we are talking about original Medicare A and B and a Medicare supplement, then you do have the option, it's highly recommended, you get a drug plan. So a prescription drug plan, Part D, yes, they can be one and the same when it comes to Medicare supplement, prescription drug coverage. A lot of people will say, well, I don't need drug coverage. I don't take any prescriptions. Well, they need to understand that's all good and fine, but you only have one time per year to enroll in this. You never know what's going to happen in the middle of the year. 6 months later, you may need an expensive medication. But in addition to that, you're penalized. I believe it's 1% every year. Chris, is that right? That you don't have a prescription drug program?
It's actually worse than that. It's 1% per month if you were eligible but not enrolled. So if you sit out, and the funny thing about the Part D, it's funny, it's not funny, it's very government. It's a mandatory voluntary program.
What?
Let that sink in for a second. Mandatory voluntary. You don't have to have a drug plan, but if you didn't enroll when you were first eligible, we're going to charge you a penalty of 1% per month that you were not enrolled but eligible. So you stay out from 1 year, it's a 12% penalty.
Extra money.
Now, it's 12% of the national premium average of drug plans, which is $34. So 12% of $34 is not that much money, right? But it's for the rest of your life. It's not for the 12 months that you were out. So I had a client the other day, it's been out for 3 years. They don't take any medications. Well, now they take a medication. They're paying a 36% penalty of the $34. That starts to add up over time. The other thing, and Tanya, I'm sorry, I'm capitalizing on your time here, but I just get so excited about this. One thing that you guys are going to run into, David, it's your organization, is you're going to run into a thing called IRMA. And it's something that we didn't put on our list over here, but I think it's important for your clients to understand and get some history with. IRMA is an income-related Medicare adjustment. It's Robin Hood at its finest. It is, we're going to take from those that did well financially, and we're going to charge them a penalty on their drug plans, Part D, and on their Part B premium, which is the cost for getting the Part B portion of Medicare.
The high crime.
It is a high crime.
Make money around here. Yeah.
And that's an important piece to the equation, going back to one of the original questions. Is it going to be smart for me to leave my group insurance plan? Am I going to save money on the premium to go to Medicare at this point? So we have to factor all those cost numbers in to create the picture of, does this decision make sense?
How long do they look back, Chris, to see if you were making, money that qualifies as that income adjusted Medicare?
It's strictly on the previous year's tax return. So okay. I have a lot of people that, at 64, their tax return showed $380,000, but their Medicare year is only going to show about $85,000. Well, they're going to pay on the previous year.
Yeah.
It'll adjust the following year to bring that back down, but it's something they need to be aware of in this equation.
So is there any way for, let's say, someone to get around that a little bit? And I'll give you an example of what I mean. Let's say somebody has a severance or a pension buyout that wasn't really in their control, that suddenly they get this big deposit of taxable money, and then wham, they're in Medicare. Is there anything that they can do to try to waive off that extra IRMA charge?
They can call their financial guy, David or Rob or somebody, to fix that for them.
Okay. Yeah, there's an exemption sheet, and a lot of people don't know that. They just get stuck with it, right?
Yeah, they do get stuck with it.
They even try. And we've seen it go both ways. It's I don't know that they have a perfect set of rules sitting out there somewhere that says if A then B or if C then D. But we've had again, having options is one of the best things in life. Let's take and see if we can get an option of getting rid of that additional premium for IRMA sometimes. Tanya, what do you think is the most common misconception about Medicare?
Oh my goodness, the one that comes to mind first is people really think that if their neighbor has something or their brother or sister-in-law suggests something, that's the plan that they need. All of the time, they think it's kind of one shoe fits all. Well, my brother said I should get on this plan. This is what they have. It works really, really well for them.
Yeah.
All the time I'm trying to explain to them, well, your brother's situation or your neighbor's situation is not going to be the same as your situation. So that's a big problem, right? They always want to listen instead of to the experts that deal with this all day long. They want to listen to their friend or their family. That's big. And then I also think, the prescription drugs and things like that. We didn't touch a lot more on the prescription drug program, but I did. Maybe you did, Chris. But even if let's go back to that a second, if we can. So even if these people don't take prescription drugs, I think there's a prescription drug program that's what, $13 a month, Chris, or $15, or like the cheapest one that they can get on.
$7.30 is the lowest period this year, and there are 35 different drug plans in the state of Texas.
Right.
And $7.30 is one of the lowest I've seen in the last 8 years.
And I'm starting to think that one of the biggest misconceptions somebody could have is that they shouldn't take a drug plan because they don't take any medications.
Definitely. That's what I tell them. You just pick the cheapest one, right? Just pick the cheapest one for the first year, and you're always going to have a chance to reevaluate that right now during open enrollment.
Good point.
Yeah. I think another misconception, people get confused this time of year with like what Chris said, Medicare supplement versus Medicare Advantage versus Part D, and plans and parts. And Chris, I think, can touch on the different plans and parts, because I had a call the other day. One of my clients said, what do I have? And she's had this plan for 10 years. What do I have? Is it a plan? Is it a part? Is it a G or an F or a C or a D? So there's a lot of like it's the whole alphabet soup, right?
Alphabet soup,
that's
exactly.
definitely confusing.
Yeah, you get a lot of that too. I bet you don't, Chris. Wait a minute, do I have A or B or do I have G or what do I have?
Yeah.
No, you actually have C. Wait a minute, what does that mean? Yeah, there's alphabet soup problem out there. An awful lot.
They're so closely related. Medicare has its parts A, B, C, and D, and supplements have A, C, D. They had F. It went away in January. Now they have G, and they have L, M, and N, and they make changes, and every time they make changes, it just creates an additional level of confusion for seniors.
Yeah.
We really appreciate that.
David, let me
go ahead, Tanya.
Sorry, real quick. One other thing that I think people should be aware of is, they're going to watch a commercial. They're going to get a phone call. They're going to be talking to a sales rep with an insurance company.
Yeah.
And people need to understand that it's not always going to be in their best interest. That insurance company is going to sell that person their product. They are not looking at the bigger picture of what is best for this person. So I would recommend always working with a professional like Chris, who is going to give you several options to choose from and tell you the best option. Chris works with 35 different drug plans and runs an evaluation on every single person. And Chris may not be contracted with all 35 drug plans, but if the drug plan that fits that client works for them, that's what they're going to get, whether we get paid on that drug plan or not. Yeah. So that's the beauty of working with someone. Don't go direct to a carrier because they're not going to have your best interest.
It's all about taking care of the client's exact needs and getting them what's best for them, right, Chris?
100%. 100%. That's why I'm a broker, in that I represent so many different companies, because there's not a situation where one shoe fits all. It just doesn't work. And
sometimes, like what I've said to families in the past is, what you're doing right now is already the perfect answer. Don't change a thing. Even though there would be some, relationship that we would get to have, a business relationship, doesn't matter. It's what's best for you. So, is there something, Chris, that you think is probably the most important thing someone could know about Medicare?
Oh man, that's a hard question because there's so many things I want people to know. But the one thing that I do feel strongly is that Medicare is a good program for people. Don't be afraid of Medicare. Original Medicare with a supplement and a drug plan gets you the most comprehensive coverage that you can get. The hard part about Medicare for people, and it's a sad state of affairs, you have to come to the realization that 45% of doctors take Medicare to begin with. With original Medicare, you can go to any doctor, any hospital you want to go to. There is nobody dictating your coverage to you other than they have to participate with Medicare. The management plans decrease that funnel down of participant physicians and hospitals because those are managed care plans that are network driven products. So the flexibility is in original Medicare. The constriction in access to physicians goes to the managed care plans. Be careful with those.
Yeah.
Because you can limit your opportunities, and don't get so taken in by a zero premium thing, thinking that I'm going to pay zero premium. You're still going to pay if you use the benefits. And we can get way more detail than we want to in that. But just know that Medicare is a good program. It is not a bad program. Don't be scared of it. It's not going away. We're going to be okay with Medicare, and you're going to get good comprehensive coverage.
Yeah. So, okay. So here's a question that's just come in from Lorna, and Lorna wants to know if we can explain for just a second the difference between A, B, C, and D. So just those four. Let's leave out the supplements. And what she's asking about, guys, before I let you tear off into this one, is A, B, C, and D are just your traditional Medicare. That's where your Medicare. That doesn't have to do with these other. There's another A. There's another C. There's another was F and G and L and N and all that. But let's just say A, B, C, D. Take just a second and let's break those apart. Tanya, will you start with one that you want to do, and let's hand this off to Chris in a second.
All right, so A, Chris is going to correct me, right? It's okay. A is, you typically are enrolled automatically in Part A if you've worked a certain number of months throughout your lifetime, right, Chris? You can correct me if I'm wrong. He's the expert. That's what you get. You don't pay for A. If you've worked, how many quarters, Chris? If you've worked a certain amount of time.
Let's just
A.
40 quarters of your lifetime. So 10 years. If you've worked
there you go.
quarters, 10 years of your life.
There you go.
In the Medicare, you automatically receive A. But what is A? A is hospitalization. It is Medicare's hospitalization. It has a $1,400 deductible. After that, it's an 80-20 plan. Simple. Anything happens in the hospital falls under Part A.
Yeah.
Part B.
I was going to say that. Chris.
I know you were.
You are right there.
It was the quarters I couldn't remember.
Part B is anything that happens in a doctor's or specialist. It's very simple. $198 deductible. After that, it's an 80-20 plan, meaning they pay 80%. You're responsible for the deductible on the 20%.
Yeah.
That's original Medicare. There is no drugs. There's no dental. There's no vision. There's no hearing.
A and B is original Medicare.
A and B is original Medicare. When you look on your Medicare card, it's going to say Part A, hospitalization, give you an effective date. Part B, doctors or medical, here's the effective date. And that's what that applies to. Now,
let's talk about that for just a second. I want to jump in right there. B, when you get B is when you start that initial open enrollment period where you don't have to answer any health questions, right, Chris?
Let's back up for even farther.
All right.
Okay. When do you enroll in Part B? Because you don't automatically receive Part B when you turn 65.
Right.
You have to declare. Well, what if you're going to maintain working and you're going to maintain a group health insurance plan? You're not going to enroll in Part B because why? It's going to cost you money. Part B is not free. Part A is free, or you've paid for it. We don't want to say free because you paid for it. Part B has a premium attached to it. It's $144. And so if you're going to maintain working and you're going to be on a group plan, you don't need that portion of Medicare yet. you can defer that enrollment. Okay.
Mhm.
If you want to take Medicare at that point, but you don't want to take Social Security. A lot of people aren't ready to take Social Security at 65. So you can enroll in Part B and defer your enrollment in Social Security.
Wait, how do you pay for it if you're not getting your Social Security check, Chris?
They're going to do this great thing. They're going to bill you quarterly for that. It's a great service the government provides to you. They're just going to send you a bill for 3 times the amount.
They don't just give it to you for free because you're not collecting your Social Security and then just come back after it later. I had somebody ask me that one time.
Nope. They don't build up that escrow fund for you.
Yeah, that's a shame.
So now then to where you were at, once you have received your Part A and enrolled in Part B, then you are in your open enrollment period.
Okay.
That open enrollment period allows you to make a declaration of either a Medicare Advantage plan, a supplement plan, or a drug plan.
How long does that last? How long is that open enrollment?
Okay. For Medicare Advantage and drug plans, it starts 3 months prior to your birth month, and 3 months later. So you've got a 7-month enrollment window.
Okay, so if I'm born in September, that
Correct.
means you got, let's count these backwards and do the knuckle thing. I had August, July, and June. So June 1st would be the first time that I could really start to make a decision on what I want.
Absolutely. Start your investigation then.
And let's say too, if I'm going to turn 65 in September, there's something else that's going to be a trigger for me to tell me I need to call and talk to Chris and Tanya. And do you know what that is? Your mailbox is going to fill up with all the stuff from everybody that learned that you're turning 65. That's the key, right? That's the time frame when it's best to come contact us. So we have that 3 months before, our mailbox is full every day. And then we have our birth month. So I had September. So I had the 3 before, then my actual month, and then the 3 after. So I had October, November, and December. Also, that were my open enrollment to make a decision.
Correct.
Yeah?
Correct.
Excellent. Okay. So there's enough time to get some choices there. Even if you're not paying attention to the fact that you're about to turn 65, you can still decide a little bit behind the ball and still be okay, right?
Correct.
Okay.
And then supplement plans actually have a 6-month window from your birth month. So if you're turning September 1st, you've actually got 6 months after that to get onto a supplement plan under guarantee issue, void of any kind of medical underwriting.
So guarantee an issue, like you just, it means no health questions. I want that plan. I get that plan.
Fantastic. Yeah. That's exactly the way it works.
Well, it's pretty easy to do.
It is.
So I definitely can get the plan that my brother has because that's the one that I need, right, Tanya?
Right, absolutely. until you go to use it, I'm kidding. No, You want to make sure that you talk to someone so that you're getting your personalized plan that fits David Maxwell.
Yeah, and I'm going to tell you too that I've worked with seniors now for almost 20 years, and Medicare, as you said, Chris, it's a good plan. My own family, I tell people regularly that my father wanted to have that freedom, that broad network of if they take Medicare, I get to go there. And when my father was diagnosed with cancer, he wanted to go to MD Anderson, and that's where he wanted to get that treatment from. And because he had that broad network, he went to MD Anderson. He got his cancer treatment done, and he paid at that time $140 to be treated for 9 weeks at MD Anderson. And now, God bless, last week we got his 2-year notice that he's cancer free. So go where you want, right?
Absolutely.
Yeah. Hey, David, if I can say one thing, I think this is important when people, if people are not calling and reaching out to someone like Chris, who's a specialist in this, and they get enrolled in a Medicare Advantage plan and they end up hating it, not liking it, they can't go to the doctors, or their doctors have dropped out. There is no guarantee that they can go into a Medicare supplement plan. So I tell people, when you start out, you want to get on the plan that you will be happy with for the rest of your life. And no one's ever going to be unhappy with a Medicare supplement plan. They might be unhappy as their premiums do increase on occasion. They get older, their premiums are going to go up some, that's the reality, but their benefits aren't going to change. They're going to continue to have that freedom. So that's a good piece of advice that I share with people.
Well, I just got a question that came in from, well, there was wanting to know this. What is if you got someone who's healthy, okay? And I got another question that came up after this in my mind a second ago that you triggered for me, but if someone's healthy, what is the downside to signing up for an Advantage plan rather than staying with the traditional Medicare supplement, a Plan F, Plan G, something along those lines? What do you think, Chris?
Yes.
Well, I think what I just mentioned, if and Chris, I'm sorry, just correct me if I'm wrong, but if they get on that, they're healthy, well, they've got the rest of their lives, they're going to be on Medicare. They're not gonna, they're not gonna get younger, they're just going to get older. And things can happen. So they can acquire a medical condition. And then now all of a sudden they have this condition and they want to go to MD Anderson, and maybe this plan will not allow them to go there.
That's a good point.
My response is I say this a lot. It's like trying to buy car insurance after you wreck the car. You can't do that. So a lot of people take the Advantage plans early when they're healthy because they don't need the supplement. But it's when they need the supplement, right? We don't have the proverbial crystal ball. We don't know exactly on February 28th of 2027 that I'm going to have an issue. If I did, this whole process would be very simple.
Yeah.
But you don't. And so once you need the supplement benefits, let's say you get into a cancer situation like you talked about, and you have to go to chemotherapy or radiation, and you realize that your plan only pays 20, you're responsible for 20% of that coverage for each visit, and you're going to go 3 times a week. Those numbers start to rack up. And it's the individual details on those plans that get you in physical therapy and chemotherapy and radiation and things that are continued long-term treatments of those processes. Supplement wise, you can always get creative with the premium amount. A Plan F is the Cadillac version, which is not even offering anymore as of January 1st, 2020. It's gone. So you can't even get it if you wanted it. But you could do, say, a high deductible Plan F or a high deductible Plan G that has a much lower premium, right? So you're able to absorb some of the risk in that situation to where you're not paying a high premium for something until you need it. So therefore, you could then set back the deductibles like $2,500. You could set back, kind of create your own HSA kind of a situation to where you prepay your deductible in the event something happens, and then the benefits kick in just like a regular Plan F would. So there are strategies that can help you lower the premium if you're in a situation where you're so healthy you just don't need the really high coverage.
That's a good plan. I mean, a good approach in saving that, with the high deductible options that are out there. If you're that one that every morning you're out walking, even in this cold, weather, you're staying healthy. And that's part of your lifestyle. Right. Saving some dollars is always a good idea, so long as you know that you've got what you need, out there on the back end. So one of the other ones that come up, and so we talk about hospitals, doctors, outpatient stuff, drug plans. We're missing something here, guys, that a lot of us start to have some problems with as we get a little bit older. And I don't have mine on right now because they get a bad glare. But let's talk about glasses and dental work. Is there any option for glasses and dental out there?
I'll let Tanya handle this one.
Well, there are. I mean, yes. So if you go with a supplement plan, those will not include dental or vision. So people they leave their corporate job and they're used to the whole shebang, the dental and the vision, and they want to continue on. There are lots of individual dental and vision plans available in the private market.
Yeah.
So that's another consultation. Do you want to go to any dentist, or do you want to stick to a network? Absolutely. That's another expense if they go with the Medicare supplement plans. I will tell you this, oftentimes if somebody is going to retire, they get COBRA offered to them. Sometimes we will move their medical, but I will tell them, listen, if you've got some major stuff coming up with your teeth, you might want to just continue dental through COBRA.
Great idea.
Now. So a lot of times people don't know that they can kind of mix and match. They think it's all or nothing when it comes to COBRA. So there are options. Yes, lots of individual dental plans out there.
That's a really good point. So
So let me give you my 2 cents on it. So I struggle with this one. As we get older, what's the first 3 things that go? Our ability to see, hear, or teeth, right? From an insurance actuarial standpoint, it's a lose-lose proposition for an insurance company to offer insured benefits on declining health.
Yeah, it makes sense.
That's a reality, right? I'm not making this up. This is a reality. So it is a difficult proposition. One of the questions here is we're hearing about $1,000 from Medicare that you can use for dental. Understand that those are what are called VARs, value-added resources that are included into those Medicare Advantage plans. Why do you think they're hitting on them? Because they know original Medicare doesn't cover them.
Yeah.
Be very careful, because that is a selling tool. That is a enticement into a program. Generally, those plans.
Chris, that this company knows they're going to spend that $1,000 on you that they're going to give you, so they're probably going to do something to get it back.
Absolutely. Absolutely. And
You
most of those benefits, you need to really drill down to them, because they're basically a couple of cleanings, an exam, maybe an x-ray a year, their lenses and frames every 2 years, their hearing aid every 4 years. So be very careful what you read into those enticements. Are they valid? Do they have merit? Yes. Are they in network? Only go to their dentist? Yes. Are they vision providers only in their network? Yes. It's not going to give you the flexibility of the things that you need. Now, I prefer specifically a discount plan option. I prefer to pay for my dental is $16.95 for me and my entire family. And then I pay a 50 to 60% discount on services rendered. So if I need a crown, it's a $1,400 charge. I'm going to get it for about $650, $700. I personally would rather pay for the services I'm receiving versus wrap my money up in premium. That's my personal agenda. So therefore, Tanya, you can take your side of it, but it's tough. It's tough.
But again, you have those who like it like you do, Chris, and you have those who like it the way Tanya's talking about. Years ago when we had Plan F and Plan G, I would tell people on a regular basis, because they're really close to each other. There's only one major difference, which, let's say you go to the doctor and you want to be the one who slides your card down and you never have to worry about paying a thing. But you're going to pay extra premium for that. Or are you the kind that when you go to the doctor the first time in the year, you go, yeah, I know I got to pay a little bit for this visit, but then you're pretty much good. Which person were you, right? We're all a little bit different. So it's good, again, have these options that are there. So, I think whether, and we haven't addressed one other person in this story. We're in a pretty strange economy. I know you can both agree with me, right? That there's some things going on in the world out there. And there's a lot of people who are losing work. There's a lot of people who are going to have to make some different choices on what they're doing. They're losing benefits that they're accustomed to. And I want you to know that they got these two. So for all our families out there listening, guys, these two have answers for us, whether it's your children or your grandchildren that have lost jobs and they're looking for that healthcare benefit. We've got to get in touch with Tanya's team over Tanya Boyd Associates. If it's something where we are over in the Medicare age, because we've got to get in touch with Chris and get these answers, whether it's what do I do about Advantage? What do I do about traditional? Should I have drug plans? But this economy is changing so quickly that we want to have professionals there to support everyone. So if you're there, I want you to be able to take down a note on how you reach these two great people. And if you had more questions, I'm sorry we couldn't get to all of our questions today. We hit a few of them, but if you want to reach out and be able to get in touch with Tanya Boyd Associates, you've got to call 972-203-8180. 972-203-8180. Okay. Or you can go to Tanya's website as well, which pretty easy, guys. Tanya Boyd with an A, Tanya, Boyd Associates.com. So TanyaBoydAssociates.com, and all the contact information, see some more about the team, things that they do there, and reach out to them. And if you want to be able to get in touch with Chris, Chris, give me your phone number really quick again, because I always just text you and I just look it up as Chris. And it's so easy for me. And then when I talk to Tanya, I usually just tell my phone to text Tanya, but I had hers written down here for the office because I call Tanya on a different number. So Chris, tell everybody your number so they can get in touch with you.
Okay, you can call me direct at 214-385-0220.
One more time.
214-385-0220.
Excellent. Excellent. So again, sorry I didn't have that one written, Chris. I just tell my phone what to do.
No worries.
But guys, I want to thank you both for taking some time with me today. I know it's a busy season for you. And so I really, really value and appreciate your time. And I know our clients who've worked with both of you guys really have valued and appreciated your time. Or I wouldn't keep sending people to you because you just do a great job for families. So I want to thank you guys. Anything in closing that you want to be able to say?
Don't be afraid to reach out. December 7th is coming up fast, and my phone is blowing up, and it's going to continue to blow up, and I will work tirelessly to find solutions to your concerns as quickly as I possibly can. So don't be afraid. You need the education, you need the information. I got it.
Excellent. And one thing also, guys, to my families out there watching, that we record these sessions and it will be available to rewatch, or if when I was talking a minute ago and you're thinking, you know what, my son was laid off recently and I wasn't taking notes, I wasn't here. All you got to do is click the link that'll come out in the next few days and forward that on to those who are important to you so that we can get everybody the help that they deserve. So as I thank you so much, Tanya. Go ahead.
Yeah, just real quick. I do if someone is losing a job, if they're under age 65 and they just go to healthcare.gov or they go direct to a carrier, I think it's important that everybody knows that they will not save money by going direct to healthcare.gov or going direct to an insurance company. They feel like if they work with a broker, there is a fee involved, and there is not. So crucial, right? Don't ever go direct. Work with a professional that's going to be unbiased and steer you the right way.
That is such a huge point, Tanya. Thank you for making it. It really is. And that's, a lot of what I talk about, how to save money. So especially if you become unemployed, that's a big deal. So guys, thank you so much. If you have questions for us as well, you can always reach us at the office, 214-771-3363, or you can go to our website. We love the website. If you haven't looked at the blog lately, go look at the blog at lakepointadvisorygroup.com. Again, thanks. We'll see you soon for the next Food for Thought. Bye, everybody. Bye, Tanya. Bye, Chris.
Thank you. Bye-bye.
Guys.
Bye. Thank you.
See ya.